Great, thank you very much. And actually, let's talk a bit about the time, that we are on these therapies. You mentioned that they've taken for a very long time. So, one of the questions, we have actually a number of questions, some that were submitted before, some I see coming through the chat. Just for people that just joined us, you can submit questions via the Zoom chat or Q&A or on Facebook Live, and we'll try to get to as many of them as we can. Does taking endocrine therapy for 10 years, so it tends to be prescribed between 5 and 10 years. So the question is, does taking endocrine therapy for 10 years instead of 5 years significantly decrease a person's chance of recurrence? And, should women at higher risk for recurrence continue aromatase inhibitor after 5 years of treatment? And maybe just to add to that, which actually I think we just got also on the chat, the opposite is, why don't you take it beyond 10 years? Since hormone-sensitive breast cancer can recur 15 to 20 years after treatment. So does it matter?
So these are very, very complicated questions, and the field is evolving, I think. Historically, breast cancer endocrine therapy was given for 5 years, and that's just kind of the way the studies were done many, many years ago. But as you indicated, the risk of recurrence of hormone receptor positive breast cancer does persist for a very long time. And if you look out even 15 to 20 years after diagnosis, it's pretty constant. It doesn't drop off. It's a relatively low risk each year, but it doesn't get lower after a certain time point. And that's different from the other subtypes of breast cancer, which have a higher risk of recurrence very soon after diagnosis, but then the risk really does drop down. And so because of this longer term risk, people have started looking at longer durations of therapy. And there's definitely data for tamoxifen, which is one of our hormonal therapies, demonstrating some added benefit for 10 years compared to 5 years. And then there is also data looking at, for women who started out with tamoxifen, if they want to then do the second part with an aromatase inhibitor that does demonstrate benefit. For the aromatase inhibitors, there have been several studies looking at just plain old doing 10 years of that type of medication, and the findings have been a little bit more mixed in terms of how much kind of added bang for the buck you get with extending the therapy. I think in my practice, we always plan for at least 5 years, and I think that for women with higher risk disease, I encourage them to consider longer therapies. But what also comes into play is how they're doing. And we're going to talk about some of the side effects, but quality of life and side effects and individual patients' preferences certainly come into that